Hi folks, greetings from India. I am Dr. Bansal, neurosurgeon from Jaipur, India. This 29th of October is being celebrated as World Stroke Day. So there is some information regarding the very important points about the stroke today. I'm going to tell you guys now that the stroke is just like a heart attack. It's a brain stroke or a brain attack, you can say. What happens is actually there is that the brain, the vessels of the brain which brings the blood from the heart to the brain suddenly gets blocked, and when it gets blocked, the blood supply to the brain is hampered, and once the blood supply is hampered, the brain cells are going to die. You can imagine that in every second 2 million brain cells are dying if you don't get the right blood supply. So once the stroke happens, that then it can give rise to many problems to the patients, like the paralysis to the face, paralysis to the arms, and then paralysis of the speech also, and then patient can be unconscious, patient can throw seizures also. And what are the important factors which patient can have before, or the high risk patients which can have stroke, we should know. These are the most important, like high stress life, very much stress in the life. Patient have diabetes, patient have hypertension, and then patient have any other metabolic disorders like kidney failure or something else. These all things, they predispose to the brain stroke. So, but the brain stroke is a problem which happens suddenly. Like if 5 people are sitting together, talking together in the office or anywhere, and then suddenly you can notice that somebody's face is drooping or somebody's eyes are not being closing. So you can say that patient might be developing stroke. It is very easy to find out one who is developing stroke. Like there is a mnemonic called FAST, F-A-S-T. First of all, we should see the F. F means face. If the face is becoming asymmetrical, like one face is drooping and one face is normal, then you can think that this person might be having stroke very soon. Then A is for arm weakness, like one arm is working and another arm is drooping. So you can say that this patient is having stroke on one of the side of the brain. And then S for the simple speech. When patient is not able to speak properly, like he is slurring, or he cannot speak, or he cannot take out the words, cannot be taken out from his mouth. Then T is the time. The time is very important in these all 3 symptoms. If you bring this patient immediately to the doctor, to the hospital where all the comprehensive care is there, like CT scan, MRI, angiographic fluids and all these are there, then we can immediately restore the patient's condition back to home, back to normal. These strokes are hypertension is very important in these patients when they do not have the antihypertensive medicines in the morning, or very simple things they have to do when they get up in the morning. The most commonly these strokes happens in the morning when they get up from the bed after a long sleep in the night. When they get up in the morning, suddenly your heart rate starts jumping, and your blood pressure goes up and your sugar level goes up, because when you are sleeping, your temperature is low, pulse is low, heart is low, BP is low, everything is normal, below than normal, because when you sleep, you don't require much. So when you suddenly get up, all the machinery starts working. So when suddenly they start working, because you are getting old, you already have diabetes, you already have blood pressure, so these vessels are weaker. When suddenly these things, machinery starts working, the blood starts pumping, heart starts pumping high level, then these vessels can get ruptured or can get blocked immediately, and you can have stroke. So these stroke patients should have a formula of 15 or a rule of 15, that when they get up from the bed, first of all, from 15 seconds they should turn for 15 seconds in the bed and lie down before getting up. Then they should sit down on the bed by hanging their legs by the side of the bed for 15 seconds, and then next 15 seconds they should get up from the bed and stand by the side of the bed for 15 seconds. So by this 45 seconds will be utilized as becoming their body to be normal. Otherwise they can have stroke. So if you can practice this thing normally every day, even if you do not have all these risk factors, you can avoid many times the stroke. I wish you all guys stay healthy, and India is now no more developing country. We are now in developed countries. We have all the equipments, although we are not making it in India, many of them, but we are bringing it from Europe and we are giving you world class treatment here. So I wish you all to stay healthy, to take your proper medicine, proper pills in the time, and avoid stroke. Thank you.